We have here, oh, this will be a fun one for you. This is Tony, him from Mexico. COVID conspiracy theories, and you've been able to find some information? What you got?
Yes. Uh, well, first of all, Puck, I just want to say congratulations for getting such awesome co-hosts. Because I wasn't originally going to call, but once I heard what Keelah was saying at the beginning, I thought I'd give it a try.
Thank you for
Yeah,
calling
absolutely.
in.
This is the easiest show I've ever done. Crafty's giving like better answers than I ever could. So I'm basically just the
Yeah.
call operator here tonight.
Yeah, and then after that, she was talking about other things with about medication. So I was wondering if I could switch my subject to that about bipolarity.
Not too much a fan of switching subjects. Let's talk about what you wanted to talk about. There's plenty of other places to have more conversations later. But
Absolutely.
let's talk about what you called about.
Sure. Absolutely. So what I was going to talk about is because there was a caller saying that talking about the freedom and that the vaccine shouldn't be mandatory. But I want to talk about the economics of it, because I have been like swimming in this a lot of groups in social media that give me all this like evidence and how the vaccine is bad and a lot of things. And one of those is that, for example, the vaccine has had adverse effects on young people, and it has now been accepted to be used in children below the age of 12, if I'm not mistaken. And the people that decided this, I don't remember, it was in the FDA or maybe the CDC, I don't know. They were they're always supposed to be neutral about the decisions of giving green lights to vaccines, but all of them, and I looked it up, all of them had ties with Pfizer. They all had something to gain, vested interest, every single one of them. So, I mean, these vaccines, when they are, even, it doesn't matter, we're talking about pencils or vaccines or cups, they cost money. Somebody has to pay for them. And for example, let's say Pfizer, for example, it has to be making a lot of money out of this. So, I mean, I wonder what Keelah's take is on this, these facts that reveal the ugly truth about, doing it for profit.
Yeah. I can understand where you're coming from, and I love economics. Here's the thing, though. When it comes to the vaccine being safe for children, we do have to trust in the people who have spent their lives developing these things. And the likes of the FDA, the likes of the CDC, the likes of the WHO, who are making decisions, as you said, independently. And this is why some of the vaccines are not being permitted throughout Europe, throughout the US, because they won't allow for testing, independent testing. I've had these discussions with a range of different people. I actually have a friend who works for Pfizer. So let me explain to you what actually happened. In the 9 months after the lockdown, the initial lockdown, we went into lockdown in March. But after the initial lockdown, they spent 18 hours a day trying to develop the vaccine. That all has to be paid for. The work that was done has to have a value. And when you're talking economics, you're talking about value. You're talking about use value. You're talking about exchange value. And sadly, that is the world of economics. Now, would I love to see vaccines being supported by or being developed by the state? Yes. However, at the moment, because of the way states are run, they don't have the time, the expertise, or the cash inflow to do that. And that's why we have these private companies. Now, it is useful to have competition. This is what capitalism is built on, is having competition to be able to say, well, and you've seen this in the rush between Moderna, Pfizer, and AstraZeneca. My vaccine is this percent effective. Mine is that percent effective. Well, mine is better. And it actually pushes, instead of just pushing competition, it actually drives the price down for governments. So the more and more you companies, private companies that you have developing it against each other, and this is part of the problem with I think it was Moderna, who was refusing to allow a new company, a generic company, to develop their drug in order to give it to third world countries or developing countries. This is a problem. Nothing, when it comes to a worldwide pandemic, the biggest issue has to be, yes, it's being done in partnership between private and public, but it has to be accessible to everybody on the planet. And at the moment, that's not happening. The only difference is you see China coming up with theirs. And I hope that China will give their vaccines over to independent testing so that we can ensure the safety of humanity. And if they're going to vaccinate the people that the likes of AstraZeneca or Moderna won't, that at least that protection is being granted. But again, it's the safety aspect that has to come of it. You know, it has to be assessed by independent variants. If it's not being assessed by independent variants, then what you have is a company or a government saying, my vaccine is the best and, you know, screw you. And that doesn't help anyone. You know, that's a race to the bottom. So that's my take on the economics of the situation. Yes, companies do it for profit, but you have to remember that a lot of the research that's gone into the COVID-19 vaccine has happened over the last 20 years of analyzing other COVID variants. So it's not just all of a sudden it came out of nowhere. It has been long in the pipeline to develop this vaccine. So that has to be covered for years and years and years. Nothing came of it. Now something's coming of it because we have this global pandemic. Do you know what I mean?
What do you think, Tony?
Yeah, well, how do we, like, for example, how do I know, like, they're not hiding adverse effects that are coming from the vaccine and they're just pushing it for a quick buck, for example, for the children? Because all the people that were supposed to be neutral when they were deciding whether or not they give the green light, they all have a vested interest on a specific company that was pushing this vaccine for the children, in my specific example.
Right. So this is piped out, you know, interlocking boards. Everyone is on everyone's board and they all have vested interest. They have more interest economically to get the countries back working. That is when it comes down to profit. That is the big thing. It's worse for them the longer the lockdowns happen. You know, economically, it's worse the longer the lockdowns happen. So in their best interest, they are trying to jump on board of this to solve the problem as quickly as they can. Now, a lot of people don't trust them. Understandably so. But when it comes to human life and getting profits back, they're not going to get profits back if the economy is closed. That's the very simple point. So at the moment, a lot of people or a lot of companies are coming on board with the large drug companies in order to ensure that we get people back working, that we get people back out spending. Economically, it makes more sense. And when it comes to the side effects, I hate to say it, man, if you actually look on their websites, they tell you what the side effects are. They've shown you all of the drug trials, or most of the drug trials, are public knowledge. Or the summaries of them are public. You can actually get hold of them.
What about the number of people that actually have had adverse effects from the vaccine?
What about 52% more people haven't had adverse effects? Are we to? And this is the problem when it comes to vaccines or any medicine. There is going to be adverse effects. But this is a global pandemic that we're facing. There are going to be adverse effects. We're going to get better at refining our medicines. And as we go along, the less people that are vaccinated, as I said earlier, the more variants are going to spread and the more they're going to be resistant to those drugs. And this is part of the problem that we're facing at the moment. So are we going to stop? It's basically like saying, we have 100 car deaths in this one spot every year. So therefore, people are not allowed to drive down this road because we're having accidents. No, you put safety measures and you put like cameras in there. You put or speed cameras. You put a new speed limit there. You make sure everyone's wearing their seatbelt. You bring in new legislation to make sure people comply to make the road safer. You don't just say, well, because there's road deaths, we're not going to drive cars anymore. It's the same thing. Yes, there's going to be, unfortunately, there are going to be adverse side effects. But at the end of the day, the alternative is so much worse and so much bleaker than you actually realize. And if you realized what my friend in Pfizer actually told me of the rate that they were initially expecting this to spread, you'd be horrified.
All right.
Yeah,
Well, thank you very much.
Certainly give me a lot to think about.
Yeah.
Thank you.
So thank you very much for giving us a call, and hopefully you'll look into this stuff and see if there's anything else. Get back in touch with us. Engage with us.
Yes, please do. Please
tell
do.
us what you've learned.